There's been little change in the rate of HIV amongst intravenous drug users in the city. That's according to a national study conducted of more than a dozen Canadian cities. But addressing two issues could make a difference.
Prince George joined the likes of Edmonton, Vancouver, Toronto and Ottawa in conducting a survey on the incidence of HIV and hepatitis C amongst intravenous drug users. It's the second such survey, with the first taking place in 2008. One of the lead researchers, Dr. Russ Callahan, says one thing leapt out at him.
I think it's the continuingly high levels of HIV and hepatitis C in this particular population. That's probably the most surprising finding for me, is that it continued to be high, and also that we had large amounts of mobility between Prince George and other regions, other communities in northern BC.
The results of the survey found the rate of HIV among intravenous drug users in Prince George was 5% higher than the national average. Among the communities surveyed, that is the second highest rate.
One more HIV is a little too much for everybody to take. So it's disconcerting, but this study also included people who already knew their status. They joined the participation, and that also might reflect in this new number that we've seen. But it's not very different from what we saw 2 years ago.
The mobility factor is one of the more significant issues in Prince George, as the transient population is far more likely to fall into the wrong crowds.
It's problematic, but it reflects the dynamics of the situation that we have here. People gravitate towards where they can get the product they want to use.
This survey was conducted prior to the launch of a couple of initiatives. The first is the HIV 101 campaign, which promotes the regular testing and education. The second got started locally this week, in which those admitted to hospital can voluntarily be tested.
I think it should. I think the Northern Health has done a pretty good job about reaching out to these vulnerable or marginalized populations, for sure, through Stop HIV, that particular program, through the testing in the general population, other folks that visit health services, for sure. I'm hoping that it will. I think the other big thing, too, is that we need to also do other things as well to reduce some of these high patterns.
Northern Health says the best way to tackle HIV and live a normal life is to be tested. Cheryl Jan, CKPG News.